Tania Dempsey, a board-certified internist, founder of the AIM Center for Personalized Medicine, and a mother of three. Doc, since we had you on just 3 weeks ago, some school systems have opened, and some which did have already closed again. Some aren't even trying. They're opting for distance learning, which nobody really likes. Do we know enough about this novel coronavirus to be sending young kids and aging school teachers back to school?
Well, I think the answer has to be no. I understand the issues that we're concerned about as far as children's learning, children's social development. I mean, there are lots of issues here that schools have to consider. But the problem is we are still learning about this virus. It's only been a number of months, right? And we are learning every day about how this virus acts. Now we have reports now of a possibility of reinfection. Here we are thinking that maybe having the virus protects us for a period of time. Now we're not even sure about that. And so we're sending people into the classroom who we have high-risk teachers who are concerned about their own health. We have kids going home. Some of these kids live with immunocompromised parents or grandparents or others, and we do not even know what is going to happen to the children. We are just learning about the impacts of COVID-19 on children, and there may be long-term consequences for them even.
Well, in a statement titled "The Importance of Reopening America's Schools This Fall," the Centers for Disease Control and Prevention states, the best available evidence indicates if children become infected, they are far less likely to suffer severe symptoms. Death rates among school-aged children are much lower than among adults. And the president has called children, and these are his words, almost immune. Doctor, school systems were shutting down as early as late February, and admittedly, this is my layman's surmise, but I want to try it out on you. Is it possible that we are misreading how susceptible kids are because we took them out of harm's way by closing schools so soon?
No, you bring up an excellent point, and I think that's absolutely a possibility. How do we know? We haven't had the kids in an environment where they are together with the possibility of germs passing between them. We haven't seen that yet, so we don't know that. We also don't know about, we haven't been testing adequately. We don't have reliable testing. We don't really know what the possibility is going to bring here with these children. So I think you bring up a good point. We are essentially going to be running an experiment on our children, sending them back into the classroom now.
That's a scary thought, but experiment's probably the right word. Here in Rhode Island, they were hoping for a statewide reopening August 31. That got pushed back to September 14 with fingers crossed. And as our governor and commissioner of public health and education are devouring data and reconfiguring schools and bus routes and everything else that goes into Plan A, B, and C, the state's second biggest city said, "Count us out."
The Warwick School Committee voted last night to approach with a full remote, and one of the concerns, and you mentioned, was air quality and ventilation in these older schools. What are your thoughts on them taking that action and that being one of the main reasons?
I could not be more disappointed in the vote that they took. They just threw in the towel on those kids. And I think the children of Warwick deserve better. They didn't even submit a plan for in-person learning. You asked about your town. They didn't even do the hard work required to give us a plan for in-person learning. They threw in the towel before they even tried. And we are hearing from parents who are saying, this isn't fair to my children. And you know what? They're right. It isn't fair. Those kids deserve better. And I am so disappointed in that school committee. It was wrong-headed, and it wasn't thoughtful, and they can do better, and I hope they'll rethink it, and I hope they do better.
Doctor, whether cities like Warwick are prudent or pushing the panic button remains to be seen, but suppose we send kids back into the classroom and one child goes home with a fever. Talk about how the dominoes could topple thereafter.
And this is exactly what I've been saying. I just imagine all the possibilities. And yes, of course, as soon as a child is sick, the school's going to have to react. They're going to have to essentially contact trace. Who is that child with? Who was the teacher in the room or teachers? And then, everybody's sent home, either in that classroom or in multiple classrooms. Maybe they can try to continue leaving school open, thinking that maybe that child wasn't in contact with as many people. That would be dangerous. Right, and then they're home for a certain period of time. And do we test? How do we test? How do we follow these kids? How do we know when they can come back? And then what if somebody else gets sick while the others are quarantined? Is it because they were exposed to this original child or not? Right, you can just imagine that it's going to be a lot of sending kids home, bringing them back to school, sending them home, and so on and so forth. And so this is really stressful. I mean, they keep talking about. I've heard the argument about the children needing the security of being in school. They need routine. They need. I get that. I have children. I know that. But on the flip side, I think about how stressful it is for the child or any child to sit there and think, oh my goodness, now I was exposed to somebody there's going to be fear, then they're going to be sent home, and now they're going to feel different than the other kids. They're home, everyone else is in school. And how is that going to impact their mental health? I don't see that as a answer to helping them in the long term. I just don't see it.
We're speaking with Dr. Tania Dempsey, and you wrote an opinion piece for the local newspaper there in the Westchester area, which I think needs to be understood everywhere. Tell us about the potential for what you have called irreversible lifelong damage to patients you have termed long haulers. Explain that.
We are starting to see, definitely in the adult population, there are hundreds, if not thousands of people who are reporting symptoms months and months after the initial infection, and they are not getting better. Now, we are starting to see this again in children as well. And these patients are starting to resemble a class of patients that I take care of. It's a big part of my practice, and that is ME/CFS, which is chronic fatigue syndrome. Chronic fatigue syndrome may be a long-term effect, and what happens is that can affect their nervous system, that can affect different organs in their system. And now there is hope, because I treat patients like that, and I think that there's a lot that can be done. But what about people who don't see someone like me, who don't understand this, and now they're just living long term with chronic fatigue and other potentially disabling immune issues?
Hey, no sooner does this hydroxychloroquine quackery subside than the My Pillow guy has the president's ear about oleander curing the coronavirus. I hesitate to dignify this by discussing it, but because so much news is now noise, and because the doctor is in the house, I must ask, isn't that plant poison?
Yes. Well, so it's just so difficult to even acknowledge, a statement like that. I mean, there's always going to be people coming out and saying that they have a cure. This is a dangerous cure. But just to be clear, most plants have toxins. I mean, that's actually how they work. I mean, we use those toxins as treatments in herbal medicine. We don't think about it like that. We think that what we're using is something good in the plant, but it is a toxin to the plant. It protects them. And so, but too much of those toxins obviously are very dangerous, and herbs can be very dangerous unless they're used by someone who's very experienced. So I'm really concerned about people going out and trying to acquire this herb and doing things on their own. This is scary stuff.
And you heard it straight from the doctor. Tania Dempsey, thank you again for your time, and please come again.